So just to make this a little simpler, there's some people that thought we were just going to sell this deal. Well, we don't want to sell it to the private equity. I mean, they'll scoop it up. I mean, there are people that want to buy this thing because there is a natural wedge that gets created because over years people drink more. I mean, it's just a natural revenue stream, so everybody wanted to buy it. Everybody was interested in it. But we felt keeping it inside, it's not quite inside because Jobs Ohio is a not-for-profit private entity. But keeping it in there and using it for the benefit, an asset in the state of Ohio that has been underutilized, and putting it into an entity where we can have the revenue growth, where we can actually go out there, compete, and win against other states. And don't miss the point about a private entity being able to take a stake in a private company. When we help people and they grow, we ought to benefit. The Stanford University invested in Google. They now have about a $25 billion endowment fund. And guess what they do with it? They go see the best professors. They say, what do you get paid? And they tell them, so we'll give you 4 times that amount of money. How do you think they build success at Stanford? So, and there are more privatizations to come. They are not in this budget, but we're seeking broad authority for additional privatization. A lot of talk about the turnpike. To repeat one more time, you get $3 billion and pay down $600 million in bonds. You got $2.4 billion, and wouldn't it be great to be able to fix all the bridges, all the highways, to be able to dredge the harbor in Cleveland for double-stack container ships, to be able to bring life to Toledo by dredging that harbor. There's so much that can be done. So anyway, that is not actually in this budget, something we'll talk about later, and those communities up that are affected by the turnpike will get a big chunk of money to be able to improve their infrastructure. It is time to move forward to take underutilized assets and put them into a position of where we can have economic success. We now will stand ready for questions. I will just finish by saying we kept our word. I think we have a creative, innovative, imaginative budget. We ask all Ohioans to join us in lifting this state. We maintain the tax cuts so we can be competitive, combined with Mary's efforts to rationalize rules and regulations that don't make sense, to be able to operate this government on as quickly as we possibly can, to make it business friendly. We get calls from CEOs all the time who are stunned at what we're able to do out here, and when this budget passes, we'll get more calls. And we'll get more people interested. Tim Keene and I have to go very soon to New York to talk to the bond rating agencies. See, at some point, the chickens do come home to roost. But we think we have a package that is going to be received favorably, and we are very optimistic that the bulk of this package will be approved by the Ohio legislature. And to all the families that are out there wondering, things are starting to get better. Stay with us together. We will improve Ohio, create jobs, and give your children and your families hope. Questions?
Governor, is there a way to say of the $8 billion shortfall, you're going with that number, $8 billion, is there a way to say how much of that is filled with actual spending cuts, and how much of it is filled with government efficiency?
Well, it's all tied together, Bill. That's the thing you have to understand. Look, I have been telling you for months that any of the time we have reduced spending, we have attempted to provide those people with the tools to cope with it. You know, if you have less money and you can't afford gasoline, maybe you carpool with your neighbor. This is the way people think in real life. So if we can say to a county commissioner, listen, inside of your county, you need to work. You need to work with the auditor and the prosecuting attorney and the judges and everybody else to make sure, I don't know if the judges are included in that or not, but you need to be able to set shared services. Because, you know, auditors and county recorders and county prosecutors, they don't always like to work together. We're going to give them the tools to do it. The same with schools. The ability for them to pool their resources, the ability to repeal some unfunded mandates, the ability for them to have greater control over their costs. This allows them to deal with what is, you know, a difficult time in our state. So, Bill, you know, on all of this, we attempt to, the reform is intricately part of the changes. And that's the way we've always done budgets. And that's the way that we see this. If they start stripping out reform, it makes it harder.
So is it fair to say that the $8 billion is really filled all with cuts, but you give government more flexibility and schools more flexibility deal.
Well, I don't know that if you, I really don't know that if you increase Medicare by, or Medicaid by 4%, you actually call that a cut. But you know, in Washington they do. But we don't live there, thank goodness.
In terms of selling
Do
off,
you expect or are the collective bargaining reforms wrapped into the budget bill, or are those?
They are not.
Separate?
They are
And
not.
how many state government jobs will be eliminated by 2013?
You know, I've asked Tim about that, if we could calculate a number, and it's very difficult to do, but there are no mass layoffs in this bill. I mean, you know, it's difficult because we don't know who in this bill will take early retirement. Tim, you might want to make a comment about this. It's very difficult for us to assess, but the idea that 15,000 people were going to get laid off, which some people might have expected, isn't going to happen. Furthermore, the contract for state employees provides a return to their pay raise. You know, they were asked to hold themselves down 4%. That expires under the contract. We have not asked for reopening of the contract. I'm sure that there are a number of people in the private sector that take pay cuts won't be too thrilled with that. But we honor the contract, and well, we're going to ask them to do a little bit more to contribute to their pensions, but net they net out in a positive way. Tim, anything you want to say? I would just tell you, Laura, that it is very difficult to rack up the numbers because things are moving all over, but there are no mass layoffs. Some people are going to be out, but not a strategy that we just get rid of all these people and that saves us money. Tim?
you know, will there be fewer employees 2 years from now?
Microphone.
Tell me you can't hear me?
No, they want to record you.
You know, will there be fewer state employees 2 years from now than today? Yes. How many? Can't say specifically what that is. And even if I knew how many it was, I couldn't tell you exactly, because think about how do people leave state service. They leave, they retire, they leave to get another job through attrition. They might be subject to an early retirement initiative. They might be subject to a layoff. So exactly how it would break off amongst those categories, we cannot say. Will there be some layoffs? Yes. Will there be people who leave service through an ERI? Yes. Will there be people who leave through attrition? Yes.
And you know, and everybody's got to cope with it. For example, in the Department of Youth Services, the total number of people in the Department of Youth Services has shrunk by 50%. Martha Spone, has done a great job, she's the interim director of Youth Services. We got half the kids in there that we had before. Why? They're in more community settings. She's closing a facility in Scioto County, and people are going to be out of work, but there's also bumping that goes on. I said, well, how many people lose their jobs? Well, some people will bump, some people will early retire. My understanding is, if this is correct, Wayne, I think you pointed out to me, and by the way, Wayne Struble is my great support partner, intellectual underpinner in this whole process, along with Ben Kanzig. Wayne, you said it was 17,000 that left last year?
Over the last several years.
Okay, over the last several years, we were saying it's like 7,000. You know, there were a lot of people that moved out of the government. So, Laura, that's the best we can do for you. Jim?
Of all the privatization proposals, selling off the prisons to someone, all of that one-time money, is any of that money being used for operational costs in this budget?
It is not. I mean, is there a little bit of the prison? Yeah, you come up and do this. Jim, I think the most important thing about the prisons here, Jim, is that he's lowballing any of the dollars that we get. But you know, we're replacing also about $300 million in stimulus money that we don't have anymore. So I think, as Tim says, in the second year there's no one-time money. Maybe in the first year there may be some, but you know, we eliminate the structural deficit. Tim?
In the first year, there's an assumption of a $500 million one-time payment from the transfer of the liquor wholesale operation to Jobs Ohio. Now, of course, that is offset by the fact that we're going to lose general revenue fund revenue in the vicinity of $200 million to liquor profits, and we're going to pick up about $40 million in expenses that were otherwise borne by liquor funds. So it's a net $260 million pickup in the first year for the state. Additionally, we have assumed that we feel like we can sell these prisons for $200 million. plus. But in the budget bill, we only assumed $50 million of revenue in the first year. Again, in part because some of that revenue has to go back to the bond fund, but in part just to try to be conservative to make sure that we're not counting on money that's not there. So is there some of this asset sale money that helps us bridge the first year? Yes, but modest amounts. No one-time money to speak of in the second year. Structural balance.
The other thing is with the liquor transfer. Okay, with that transfer, there's no more money need to be sent to out of the GRF to support this operation, and it gives Kwame the powder that he needs to be able to go out and do the things to create the jobs or save the jobs so we get more revenue. I mean, those numbers that he flashed on the board. What did you say? That was $14 billion worth of payroll. You know what that means? Nobody's getting their hair cut, nobody's buying any flowers, nobody's in the restaurant. $14 billion worth of loss of payroll. We have got to create jobs in this state. And what this budget does is set the stage for precisely that. Job creation, entrepreneurship. And I know there are people worked up in the state. There are a heck of a lot of people that are very excited about what's going on in this state. I ran into one of the top executives of one of the big three on Saturday night at the Gridiron dinner. He says, we're coming to Ohio to talk to you. We know what you're all about. Now there's issues, we'll have to see. Mark's working on more deals. He was in Cincinnati today trying to attract a company into the state with 300 jobs. I think we'll hear some good news soon from Plaskolite. I mean, there's lots of things going on, and there's one other major company that we'll be announcing when it's appropriate that's staying. Joe?
Are you concerned that local governments will raise taxes to combat the cuts in funding?
Well, Joe, you know, they raise taxes in the city of Brooklyn, and it's put American greetings at risk. I mean, what I think we have to understand, and look, I'm not happy with what's happened with Bob Evans. We didn't favor one community over another. I saw that the city was just talking here about the tax incentives that they provided to get jobs here. You know, the difficulty with tax incentives are kind of one-off in a way. You want to lower the barriers to bringing people and keeping people in your community. So I would advise them to think about ways to be more efficient. I mean, the mayor of Toledo is begging for it. He's begging for a way out of his fiscal mess. So it's not just local governments, but it's schools, it's everybody have to pull together. But let me tell you this about local governments. They're getting the casino money. We're giving them flexibility and shared services. It's not just a one-way street. And again, this is a system where we collect the money and pass it out to people who spend it. Even the federal government in the 1970s realized that revenue sharing didn't make any sense. Now, they will tell you they don't like this, but I know that they thought that what was going to happen with a local government fund was going to be far more dramatic than what's happened here. And they're going to have some months to prepare for this. And there are other things that are moving through the legislature that might give them a little bit more control over their costs, I think. Reggie?
Governor, I believe Director Moody had mentioned $1.4 billion in Medicaid savings. I was just wondering if you might be able to, or Director Moody make a comment exactly how is that going to impact the 2.1 million Ohioans who are on Medicaid, and separately the plan to pay for quality over volume. How is that impacting hospitals, nursing homes, and those?
I think that's an excellent question, Greg. I think you need to come up. What I would say, you know, for example, the ability, Reggie, to move people from a more expensive nursing home setting, if it's not necessary, to a home health care setting, as we all know, saves a lot of money. Our per capita costs are higher than almost every other state in the country because that's our option. I mean, we don't even think about a lower cost option. That's one thing that is very, very significant. Secondly, we are going to place children who have not had coordinated care up till now in a coordinated care setting so that they can get the treatment that they need. It also ultimately results in better care and lower savings. Greg, you want to have more to say? Sure.
Well, one of the first things we did that will look different in this budget is normally you see a part of the Medicaid budget that's in one agency. and that tends to understate the real effects. So those of you who follow this are used to Medicaid being about $15 million, but really it's about $18 million when you look at it across all of the different agencies. So what we did was pull it together to look at it in one place, and then that let us make decisions that made it more efficient across those different agencies. So the number I gave, 1.4 billion, that's a net number over the biennium. In fact, there are things in there where we're spending more. So for example, health homes to provide better primary care and better care coordination, we are actually investing in that and spending more. What that means is then the cost avoidance and the savings are actually bigger than the $1.4 billion. But what we're trying to do there is align payment toward our priorities. What do we want to buy? Do we want to buy a mistake at the point of discharge from a hospital where a person, instead of going into their home or a community setting, because somebody didn't line that up, they're ending up in a nursing facility instead? We want to make sure that there's accountability in the system so folks can end up in the setting they prefer, and it's a better value to the system. It's one of the few areas where what consumers want actually tends to cost less. But it is a real direct challenge to the system, which has always been based on more and more and more volume. We're not saying more care, we're saying better care. So when we're then talking about modernizing payment and resetting how we pay, paying for performance, that's what we're driving at. We're driving it at better outcomes for people.
Reggie, let me